Hello and good morning. My name is Allison Shuttleworth of Expedition Ed and author of the Code Crispy blog. At Expedition Ed, we offer a range of educational services for nurses, from program development and individual coaching to customized continuing education retreats. We help nurses achieve their full potential by providing practical, evidence-based solutions to burnout, nurse retention, and professional development. Today I'm excited to bring to you the stress response in burnout, the science behind the syndrome. We'll begin with a few objectives. In 2016, the American Nurses Association conducted a health risk appraisal and determined that occupational stress is the #1 health and safety risk for nurses. That was really impressive. You would think that it's violence or infection, but no, they identified occupational stress as #1. I'd like to mention here that overtime, both intentional and forced, is a major risk factor for occupational stress and burnout. An integrative review by Caruso and colleagues reported that overtime was associated with increased injury rates, more illnesses, and increased mortality. And working overtime has a dose-response relationship, such that the number of hours increased, injury rates increased correspondingly. The amount of overtime worked is one indicator of elevated stress levels in a department. In 2009, the National Institute for Occupational Health and Safety defined occupational stress as the potentially harmful physical and emotional responses that occur when job requirements do not match the capabilities, resources, or needs of the worker. What I'm describing here is role overload. Bacchus found that employees who perceived a lot of role overload are more likely to experience increased job stress. Role overload occurs when an employee faces a lot of obligations and is not able to fulfill those in the time allotted. Job demands are not necessarily stressful, only when demands are too high or not enough time to recover, like in the example of back-to-back shifts or engaging in excessive overtime. However, employees can recover from high job demands when they possess a high amount of job resources and have their needs met. Resources are things like supplies, equipment, and personnel. Having those things available. How many times have you walked into a patient's room and not had the supplies available because there's not enough personnel to stock them? Or how many times have you had to pick up overtime because the department is poorly staffed and you're not able to complete what you need to finish in your shift, so you end up having to stay over? And I like to think about physical problems such as IBS and chronic pain, migraines, and shoulder tightness as some of the physical responses that you can experience when you're under excessive stress. And of course, emotional responses, the depression and anxiety, and sometimes the insomnia that we live with. Occupational stress is also associated with increased workplace injury. Nurses have the highest rate of occupational injuries out of any other industry. In fact, we're 2 times higher even than manufacturing and construction. We also have the highest rate of absenteeism, and we're consistently ranked within the top most stressful jobs, which of course leads to one of the highest rates of burnout. We have the highest rate of non-fatal injuries out of all professions, and OSHA ranked nurses as being the second highest profession for assaults. 1 in 4 nurses have experienced violence. And violence is related to emotional exhaustion, depression, and anxiety, all of which are essential components of occupational stress. Subjects with emotional exhaustion have a 2 times higher instance of verbal abuse. Stress increases the risk of violence, and violence leads to more violence due to a neuroendocrine feedback loop that creates a vicious cycle of stress and aggression. Occupational stress can also contribute to chronic illnesses like coronary artery disease, hypertension, gastric reflux, migraines, diabetes, and even some forms of cancer. Let's take a moment now and talk about the physiology of stress. When a person experiences a stressful event, the hypothalamus sends signals to the body of the threat, the impending doom. The hypothalamus is a bit like a command center. That area of the brain communicates with the rest of the body through the autonomic nervous system, which controls involuntary body functions like breathing, blood pressure, heartbeat, and the dilation of your bronchioles. As the initial surge of epinephrine subsides, the hypothalamus activates a second component of the stress response system known as the HPA axis. This network consists of the hypothalamus, the pituitary gland, and the adrenal glands. If the brain continues to perceive something as dangerous, the hypothalamus tells the adrenal glands to release cortisol. The body thus stays revved up and on high alert. When the threat passes, cortisol levels fall. The parasympathetic nervous system, or the brake, then dampens the stress response. When the sympathetic nervous system is aroused, also known as fight, flight, or freeze, a number of physiological functions become activated. Your bronchioles dilate, your arterioles constrict, your pupils dilate, and while it's good for the immediate threat, prolonged activation of the sympathetic nervous system can lead to problems. For example, coronary artery disease can be directly related to arterial constriction and elevated blood glucose levels. Diabetes also from prolonged states of hyperglycemia, and injury due to decreased peripheral vision and tightened muscles. As the psoas contracts, it pulls the lumbar spine and can lead to disc problems, lumbar strain, muscle pain, and other problems with hip, knee, and foot pain due to kinetic chain disruption. Migraines can result from tightened muscles in the neck, face, and frequent infections can occur due to your blunted immune response. It's why you may be getting sick more often and for more prolonged periods of time as the workload increases. Irritable bowel symptoms can manifest due to disruption of the microbiome, and we'll get to that in a little bit in later slides. Of course, not all threats are overt. There are subtle sources of stress in our environment that we may not be aware of. Particularly working in the emergency department, we're exposed to high levels of noise and noxious odors, and both of those can stimulate the sympathetic nervous system. Greater than 70 decibels of sound has been shown to activate the SNS, and on a regular day in a normal hospital room, not in the ER, but a regular hospital room, regularly noise levels can exceed 80 decibels. So you can imagine how much above that threshold we experience on a daily basis during a trauma or a STEMI or a psychiatric emergency. Researchers have discovered that humans have a hidden superpower too. It's known as chemoreceptor signaling, and it allows us to smell fear, anxiety, and stress emanating from other humans. It's believed to be an adaptive ability that allows us to communicate danger to other members of the herd without using verbal cues. The effect is that exposure to stressed out others can lead to feelings of stress in oneself. Stress is literally contagious. The kinetic chain refers to the joints that are connected and dependent upon one another to provide coordinated movement during walking. The feet serve as the base of the chain, which further extends through the knees, tibia, femur, hip joint, pelvis, and spine. When one aspect of the complex biomechanical chain is out of alignment because, say, a tightened contracted psoas from the release of adrenaline, the pelvis can be abnormally pulled into rotation, and the kinetic chain is disrupted, resulting in asymmetry all the way down the stabilizing base in the foot. This can cause overpronation, which is why many of us suffer from plantar fasciitis. When we're in fight or flight, our gut responds as well. Blood is shunted away from the gut and to the skeletal muscles where it's needed for fight or flight. Unfortunately, that can cause problems with digestion. That's why sometimes you'll feel nauseated or have a decrease in appetite. With circulation shunted away from the gut, the balance of microbes in your gut can be disrupted as well. Microbes can communicate with the brain causing cravings for nutrients that may not be in the best interest of the human's health, like processed sugars and unhealthy fats. The gut's microbiome is really fascinating. It's essential for our overall health, and it co-evolved with humans from the very early stages of embryonic development. When it's out of balance, it can lead to a complex cascade of symptoms that we experience as sometimes depression and anxiety or abnormal cravings. Serotonin and dopamine are produced in the gut by this microbiome, and in fact, more serotonin is produced in the gut than in the brain. When stress hormones are chronically elevated, harmful bacteria can thrive, dominating the gut and outnumbering the beneficial microbes. When our gut's microbial power balance shifts in favor of bad bacteria, the depleted populations of symbiotic microbes are unable to produce enough mood-stabling neurotransmitters like serotonin and dopamine. The effect is an increase in psychiatric symptoms and anxiety. Additionally, when the microbiome is imbalanced, the gut can become more porous and allow invasive pathogens to enter our bloodstream, causing sickness. Stress has long been known to be a risk factor for substance abuse and addiction. When we're stressed, our body releases dopamine, a neurotransmitter that lights up our brain's pleasure center. Adrenaline and norepinephrine are also released, raising our heart rate and blood pressure and causing us to feel excited. It's the rush that you get when that trauma is about to roll in through the ambulance bay. The physiological effect is the same as the body's reaction to drugs of abuse like cocaine and methamphetamine. Our desire to feel it again and again is reinforced by activation of the brain's pleasure center. In addition to the stress in our work environment, our culture reinforces a busy, stressed norm. Busy people are considered to be important. The busier you are, the harder you work, the faster you work, the more money you can make, and money and status are linked to importance and value in our culture. It further perpetuates the cycle of stress and addiction. There's solid evidence of the relationship between chronic stress and substance abuse. Occupational stress can result from codependent behavior. Codependency in nursing is manifested by self-neglect, a loss of personal identity resulting from an over-identification with the role as caretaker, a dependency on others for self-worth, an inability to distinguish one's responsibilities from the responsibilities of others, and a false sense of duty to others that has its basis in fear. A 2016 American Nurses Association Health Risk Appraisal found that more than 68% of nurses put the needs of their patients before their own. When you neglect your own needs, you experience increased stress. Codependent nurses place greater stress on themselves to perform and subsequently are at increased risk for substance use disorder. So a few take-home points from today. The fight-or-flight response is a primitive and protective mechanism, but chronic sympathetic nervous system activation can put nurses at risk for a variety of disorders. Standing up for your needs and setting limits can help the effects of occupational stress. It's important that you believe that you're inherently valuable so that you can avoid burnout and have a more fulfilling professional experience. Taking time to engage in self-care can help you to counter occupational stress, but it's important that you acknowledge your value independent of being a caregiver. Once you're able to value yourself, you'll be better able to set healthy boundaries around what you will and won't accept as acceptable workplace. In the references section, I've included links to articles that can help you acknowledge and strengthen your own self-worth. You are valuable. Thank you for participating in this educational activity. I hope that you're able to use the concepts presented here to effect real change in your own practice.